Hello everyone, welcome to my presentation. This is actually going to be my third presentation. This is the third article that I have chosen, and it's called An Evaluation of the Use of Management Care Plans for People Who Frequently Attend the Emergency Department. So, as I mentioned before, my subject in this class is time studies. So I thought if I analyze this article, maybe I will have an insight about the people who frequently attend the emergency department. And if I analyze a study on this subject, maybe I will be able to know if they can shorten the times, not shorten, but decline the times they attend the emergency department. That some may be able to actually overcome the overcrowding problem in emergency departments. So the purpose of this study is to examine the factors that influence the length of stay in the emergency department and to evaluate the use of management care plans for people who frequently attend the emergency department. But why will people attend the emergency department frequently, you may ask? And these people actually, unfortunately, might be going through chronic disease, mental illness, drug and alcohol addiction, or they might be homeless. So here we will have a clear insight about how this study was conducted. So the study was designed and descriptive observational design was used, and they have actually recorded the before and after measures of emergency department attendance, so they will know like if they have shortened the time or not. And the study is taken place in a major hospital in Australia. And the sample is, like I mentioned before, is actually frequently attending patients. They are potentially suitable for a management plan. This is actually 57 patients that I will talk about later. And medical record patients identifiers were used for matching the total number of emergency department visits before and after implementation. The template of this management plan has facilitated recording of a summary of health issues, a description of previous presentations, the aims of emergency department management, recommended responses to presentation, contact details for the health professionals involved in the patient care, and known community-based supports. So actually a link was sent to the all emergency department staff and to participate in the survey, and attendance and management plan data were extracted from the clinical information system. Medical record patient identifiers were used for matching the number of total emergency department visits before and after implementation, and partition demographics are analyzed, which I'm going to also talk about it in upcoming slides. And a series of questions were posed to gain insights into staff perceptions of this implementation, accessibility, and the use of management plans. And also, I will talk about them in upcoming slides. They have actually asked the staff some questions, and therefore they have gained more insights because the staff has commented in the slides. So this is the management plan developing process, and this is like a decision-making tree actually, and plans were uploaded in portable document format to the clinical information system, where they could be assessed by clinicians by the hospital clinical information network from time that the patient's emergency department was registered in the system, and plans were reviewed every 12 months or earlier if indicated. And these are actually the questions that are asked to staff. Basically, the questions are asked in order to measure if the staff is aware of such kind of management plans. Do they know how to assess it? What does staff actually need to provide a good management plan? What are the main challenges to develop this program? And in what ways this electronic management emergency department plans be changed to improve patient care? And here we can actually see the survey questions, and here is how the analysis is made. I will explain it step by step. And here actually the attendance of the patient data were exported to Excel, and analysis included counts, percentages, and mean, standard deviations, medians, and interquartile range were calculated for the majority of outcomes due to skewed distributions. Before and after management plan, data was checked for normality and errors and then imported for analysis in Stata. Stata is actually a program that they have used and they have mentioned in this article. And medical record patient identifiers were used for matching the total number of emergency department visits before and after the implementation. And later on, differences between the time periods were assessed using the non-parametric Mann-Whitney test. And the Pearson's chi-square test was applied to categorical variations of Fisher's exact tests on occasions with frequencies less than 5. Differences in emergency department attendance numbers were tested for in before and after samples using the non-parametric Wilcoxon sign rank test, and a two-sided p-value of less than 0.05 was considered to indicate statistical significance. So it's actually a statistical test. So here we can see the results. By results, I mean this is not like the test results, but this is the demographics of the 57 patients who have received the management plan. So here we can obtain information about their gender, their age, if they were born in Australia, New Zealand, or United Kingdom, if they're married, and if they're able to speak English. And so yeah, these are like how the demographics have varied. So here is actually the results. The study is actually really successful. As we can see, the before plan, I know it's kind of blurry, but the first one is before the plan and the second one is after the plan. And I have mentioned that 57 patients were in the study, and actually they have attended the emergency department 1,040. It's a very big number, 1,482 emergency department attendances. This is actually a very big number for just 57 people. And of these attendances, 830 occurred in the 12 months before the management plan was implemented, and 652 was during the 12 months after. So the number of attendances per patient decreased from a median of 11 to 4. And here we can see the visual representation of this. So this actually means almost 3/4 of patients were observed to have had fewer emergency department attendances in the 12 months after development of this plan compared to the 12 months period. And a total of 22% had more attendances after development, unfortunately, and only 3.5% had the same number of attendances. So here, this table actually helps us to have more information about the patient demographics. Here we can see why they were coming to the emergency department, what are the reasoning behind, and what are their ongoing management. As we can see, some of them are going through drug seeking, mental illnesses, social problems, social crisis, chronic and complex medical problems. They are in treatment for anxiety, unstable housing, and so on. So this actually helped us to have a better view of these patients. And actually, 41 of these 57 patients, concurrent issues impacting care was aggression. And 12 of them carried weapon, 8 of them were using verbal, like they were using rude, they were being rude to the nurses, and they were being physical, actually, 15 of them. So it was actually a very hard demographics to observe and work on. So here we can see that like I mentioned before, in order to gain insight from the staff, they have actually asked them questions as well. And there were some questions as to staffs in order to view their perspective, and I will go through these questions. And the first question is, what sort of knowledge and skill do you think staff need to write good management plans? And participations noted that Need for both patient and system knowledge skills. Knowledge of patient factors included patient familiarity and understanding of the needs of patients. More commonly, it was considered helpful to hear about health issues that could affect patients. Knowledge of the factors of the healthcare system, including knowledge of care providers within the emergency department and beyond, was seen as helpful in developing good management plans. There was also considered important comprehensive knowledge of the system healthcare and multidisciplinary care. In order to write good management plans, you have to have advanced clinical skills, and seniority were considered necessary by the participants. As we can see, their quotes: good working knowledge of patient and their behaviorism, knowledge and experience of community services and referral systems, the ability to write a brief, practical, non-judgmental plan, good analytical skills to navigate patient documents. So here's the second question, and it's asking them, what are the main challenges faced by staff who developed this plans actually? So communicational challenges included difficulty contacting and liaising with other healthcare providers and difficulties talking and obtaining information from patients. As I have mentioned, they are mostly very aggressive, they carry weapons, they are very physical and verbal to the staff. And practice challenges included difficulties engaging with patients and healthcare providers who could best contribute to management plan development. Additionally, participants recorded challenges associated with time required to develop management plans. The functionality and use of management plan presented some challenges. In particular, the need to ensure the plan had a clear purpose was highlighted. This is included making the management plans relevant to different healthcare providers and a lack of familiarity with the healthcare services relevant to the management plan. So as we can see, often people you need to speak to in developing the plan are not available. Many patients, especially homeless people, don't have mobile phones, or we cannot contact with them, and so on. These are the quotes from the staff. In what ways the management plans be changed to improve the patient care was the last question asked. So here participations indicated that changes to plan functionality and content had the potential to improve patient care. The first area for improvement was functionality, and most participations reported that structural changes to management plan would make the care plan easier to use. It has been suggested to improve the accessibility of the management plan to improve the use and wider use of management plan. Practice change was the second area for improvement, and the management plan review was perceived earlier in the episode as beneficial because the management plans were not always accessible. It was considered necessary to appropriate to involve the patient and significant others. It has suggested allocating dedicated time for activities related to management plan. So here we can see, not always seen or read at the point of triage or assessment. I'm quoting from the staff. More information about where we can discharge patients to, as often they are not forthcoming about potential discharge destinations that are available for them. And more involvement of allied health in care planning and community follow-up. So these are all quotes from the staff. And what were the strengths and limitations of this study? So this really actually is a big strength that research actually included multiple data sources like patient data, service delivery data, and staff opinion, which enables several perspectives to be evaluated. But what is the limitations? What are the limitations actually? This was only conducted in one single Australian emergency department. This is a generalization, as I mentioned in previous articles, and it's only one emergency department, unfortunately. And the design of the research meant that the results could have been influenced by other factors. A further challenge was the time taken to identify individuals for the evaluation. And the conclusions of the study is the use of management plans can be effective for those who regularly attend it. decline in emergency department visits correlated with the implementation of management plans. Mostly, employees have embraced the introduction of management strategies in emergency department, and the role of management per patient within an emergency department treatment model should be taken into account, and future research should involve patients. Thank you so much for listening, and I wish you a nice day.